have a short period, say 21 days cycle, you will still be able to track it, which is to say your ovulation is going to happen around day 11. And then if you have a longer menstrual cycle, ovulation can occur. Hello viewers, welcome back to my channel. If you're new on this channel, you can consider subscribing and turning on notification to get updates. Today we are going to be looking at signs and symptoms of ovulation. Before we go into the signs and symptoms, I want us to understand that ovulation is a process whereby the ovum, which is the egg, is released from the ovary, and this happens every month in a woman with a regular menstrual cycle. For those with irregular menstrual cycles and some reproductive tract conditions like PCOS, ovulation might not happen regularly in such individuals. Now we'll proceed straight to the signs and symptoms of ovulation. Now let's understand that ovulation happens midway in the cycle, like mid-cycle for every woman who has a regular menstrual cycle. Now the normal menstrual cycle is between 21 days to 35 days, and now the normal menstrual cycle for a woman with a regular cycle is between the 21 to 35. Anything shorter or longer than that can be considered irregular. Now straight to the signs and symptoms. The first one is change in cervical mucus. Now when ovulation begins to approach, the cervical mucus changes. Now this cervical mucus change happens all through the menstrual cycle. At some point it's sticky, and at other point it tends to be dry. But when ovulation is approaching or towards ovulation, the cervical mucus becomes raw egg white. You know what a raw egg white looks like? That is the texture that, of the cervical mucus when ovulation is approaching. So if you monitor your cervical mucus closely, you will be able to notice these changes when ovulation is approaching, especially when you have a regular menstrual cycle. Number 2 is ovulation pain. Now if you pay close attention, you will notice a sharp pain on the side of the abdomen during ovulation. Now this occurs mid-cycle, and it usually occurs like once in a month. You might get pain, some different kinds of pain during the month or throughout the cycle, but this pain is very peculiar and it happened mid-cycle. So if you pay close attention, you will be able to pinpoint this pain, and you know that yes, ovulation has occurred. Okay, so the third one is what? Increased sexual drive. When ovulation is approaching, there will be a rise in sexual drive. Maybe you're someone who really does not feel like kind of having sex every time, but during ovulation there's this drive, this great urge and desire to have sex, and this is nature telling you that, oh, this is a time for you to actually conceive, and it's actually good to maximize that opportunity. Now there are other things that can also cause increased sex drive as well, like sometimes stress and all of that can increase sexual drive, but usually ovulation does this, and it's just change position of the cervix. Now usually people believe that the cervix can only be checked by a trained medical personnel during child delivery. Truth is, you can actually learn to check the position of your cervix. You can assess your cervix. Now cervix is the opening, it's kind of like the pathway between the internal and the external reproductive organs, the external genitalia and then the internal ones, the womb, the ovaries and the fallopian tubes. That is the pathway, the gateway between the two of them. The cervical position actually changes when ovulation is approaching. It kind of moves a bit upward that it becomes difficult to assess if you try to check during that period, and it also becomes patent, like open a bit to allow free flow of sperm to go fertilize that ova. All right, so if you are able to check your cervical, the position of your cervix, you will also be able to notice the change in the cervical course as well, and this will help you to adequately prepare for conception during this period. The next one is breast tenderness. Note that breast tenderness usually does not precede ovulation. Breast tenderness happens after ovulation has occurred, and this is to show you that indeed you ovulated that month. Now, this happens when the level of estrogen rises, and the level of estrogen rises mostly after ovulation. So when you begin to have those tender breasts through your cycle, you know that indeed ovulation has occurred. Then we have also the basal body temperature. Now, the basal body temperature is one's temperature at rest. When you are at rest, you've not begun the day's activities. That is the best time to take this temperature. And then you keep a chart to continue to monitor, the temperature. When there is a surge, kind of an increase in the level of progesterone, the basal body temperature rises. So if you are able to keep track of this basal body temperature, you'll be able to know when you ovulate, when ovulation has occurred, because there will be a change in the temperature. All right, so the next one is what a positive test on the ovulation calculator. Now, the ovulation calculator works just like the regular pregnancy test strip that you pee on. So when you get an ovulation calculator, you pee on it, and then it also gives you those two lines. But when the test line is darker than the control line, it means you are ovulating at that period. But one thing that makes this very difficult is the fact that sometimes you might not be able to know when the test line is darker than the control line, and then it's also kind of expensive. Not everybody can afford it, and aside that, it might not work for those with irregular periods, because for people with polycystic ovarian syndrome, PCOS, they might get so many positives in a month, which is not true. Which is actually not true. So those are some of the disadvantages of the ovulation calculator. But if you have a regular period, the ovulation calculator can actually work for you, and it can help you actually track your ovulation and help increase your chances of conception. All right, so those are some of the signs and symptoms of ovulation that will help you. If you have a regular menstrual period, then you can actually look out for these signs and symptoms to guide you in preparing for conception. But in a case where you do not have a regular menstrual cycle, these signs and symptoms might not really work well for you. But truth is, if you are in your childbearing age and you do not want to get pregnant, the best thing for you to do is to go on birth control. Use birth control. That is the surest way for you to not get pregnant. But whether regular or irregular, if you're planning to get pregnant, then you have to continue to increase sexual activity during those fertile period, which is usually between the 9 to the 21 of your menstrual cycle. That way, if you have a short period, say 21 days cycle, you will still be able to track it, which is to say your ovulation is going to happen around day 11. And then if you have a longer menstrual cycle, your ovulation can occur from even around day 21. So you have to keep your options open if you are trying to conceive. So thank you very much for watching this video. If you found this interesting, you can click on the subscribe button to follow up as we keep bringing interesting updates. See you guys in my next video. Bye.